Hello, and thanks for joining us today. I'm Scott Mash from the CliniSync HIE. CliniSync is a healthcare technology organization that electronically connects all the hospitals, health systems, clinical providers, behavioral health, and social service agencies in Ohio. Our function is to support the transfer of data from one provider to another for a patient's care and treatment. We are a community-led and community-supported organization whose leadership is composed of providers from every area of healthcare and from every geographic region in Ohio. I'd like to take just a few minutes to tell you about a new way of coordinating care through an electronic referral system. This new referral initiative in Ohio is called Unite Ohio and is designed to connect providers and social service agencies around Ohio electronically. The Unite Ohio program is supported by a technology platform called UniteUs. So how did Unite Ohio begin? Back at the beginning of the pandemic, CliniSync's board of directors could see from emerging data that there were significant gaps in the care that people were receiving. Some of the gaps were caused by an overworked healthcare system, but many of the gaps were the result of people not having their everyday living needs met. These needs were more community-based, patients who didn't have enough food or whose housing was in question, patients who couldn't pay the rent or couldn't get a ride to the doctor. How could these needs be addressed? CliniSync's board saw from the feedback they were receiving, providers wanted a more coordinated system with other care groups and social service agencies. The board made the development of an electronic network connecting all organizations involved with care coordination a priority. CliniSync worked with over 30 provider organizations and social service agencies for over a year to identify a technology that would fill the need for an electronic referral tool. The aim of this group was to identify a referral tool that could integrate directly with healthcare organizations' EHR system, but also be easily adaptable for use by social service agencies and smaller organizations. What this work group was looking for were several things that could improve care coordination for any patient who needed additional support. It needed to be built around the community referral model and use community resources. The system must track the sending and acceptance of referral requests. It needed to track data on social needs. It should integrate with CliniSync's longitudinal record. But most of all, they wanted a partner who could work with the community and build a network that included both the largest and the smallest provider groups. UniteUs was the referral platform that the work group selected that most closely met these goals. The UniteUs tool has the ability to integrate with CliniSync and coordinate with the clinical records. It has many templates built in for the capture of SDOH data on the patient. It can track referrals and the response to the referrals by social service agencies. It has very detailed analytics to show the types of referrals made, the disposition of the referrals, and any follow-up. UniteUs referral tool is used across the nation, and referral networks have been established in 44 states. They have the highest level of security and meet all HIPAA safety standards. How has adoption in Ohio gone for the UniteUs referral tool? UniteUs was first adopted in the Northeast Ohio region over 3 years ago. All major hospital systems in that area and dozens of social service agencies and provider groups have joined. The referral tool is actually integrated into the EHR system for these participating hospitals. In Central Ohio, the Ohio State University has been the champion of moving UniteUs into the community. The referral tool has been built into OSU's Epic system for all its hospitals and providers. OSU, in turn, is now building the UniteUs platform into the rural hospitals that they support technically. In addition, over 100 different organizations in Central Ohio have joined the network. In 2024, the attention has been on identifying other regions and providers around the state and getting them up on UniteUs in their communities. Since UniteUs Referral Network first opened in Ohio, over 20,000 patients have received referrals to other support organizations. Of these referrals, over 75% of the referrals have been resolved. In the Cleveland region alone in the past 3 years, 250 plus organizations have initiated over 30,000 referrals for over 15,000 patients. Just in 2023, there were 11,000 referrals, and 65% of those were resolved. This information can be further broken down to track the referrals by type of referral or by identified need. There is no cost to participate for social service agencies, FQHCs, behavioral health organizations, or small practices. Feel free to reach out and contact myself or the CliniSync info line to get more information about Unite Ohio or to schedule a demonstration of the UniteUs referral tool. Thank you so much for listening and have a great day.